Many people enjoy going on walks, lifting weights at the gym, or maybe even joining an aerobics class. But imagine not being able to do any of those things because of knee pain. And that is what people that have patellofemoral stress syndrome experience day to day. And that is pain between your knee and your thigh bone. According to doctors Sabrina Strickland and Beth Stein, it is due to overuse rather than traumatic injury. So today I'm going to teach you guys how to protect your knees, basically the anatomy of the knee, stretching and warming up, and rest time. So your patella sits in a groove at the bottom of your femur. It's a pretty delicate joint. Dr. Greg Martin states the principal muscles involved in the knee joint are the quadriceps and hamstrings, and those are connected to your knee by tendons that can be too tight without proper stretching. There's also 4 ligaments that prevent too much movement and support the knee, connecting the femur to the tibia, and popping those ligaments can mean no physical activity for weeks. Our bodies all handle stresses different, so you need to listen to your body and take the precautions to prevent those injuries. Even anti-inflammatory medicine can help recover faster. Understanding each individual part of the knee will help you guys visualize these injuries that might occur. So the first important thing that you should do is stretch and warm up effectively. The majority of people with patellofemoral pain can be treated non-operatively, according to Dr. Sabrina Strickland. Some dynamic stretches are encouraged, like walking lunges or arm circles, to get your body fully in motion. Even experienced athletes ignore the stiffness and injure themselves because they didn't warm up and stretch, and possibly lose a really important race because they didn't take the precautions. Although stretching and warming up is important, so is cooling down and taking rest periods. To prevent strain on the knee, you must rest. According to Doctors Beth Stein and Sabrina Strickland, patients must alter any activities exacerbating the condition, like avoiding participation in high-impact sports and high-intensity workouts, at least temporarily. Just like anything, if you have too much of it, you need a break. Physical activity is very strenuous, so 7 days a week of doing running or heavy lifting is not good, especially on your knees, because like I said, they're a very delicate joint. So what you can do after you work out to prevent any further injuries is stretching, static stretching. That's holding a difficult stretch for 10 to 30 seconds. It will increase flexibility and hopefully reduce your soreness. The knee is very complex structure of tendons, bones, ligaments, and cartilage, so knowing how it works to prevent and treat that pain is 100% worth the time. You could very well be 80 years old with the best knees of your life because you did all these things throughout your life. Thank you guys.